48 million Americans, 48 million have some level of hearing loss, and this includes half of all people in their 70s. If hearing loss seems like a boring problem, I want you to think about what it means to be unable to participate in a meaningful conversation with another person, unable to talk on the telephone or to hear a television or radio. People with hearing loss are more likely to experience social isolation. They're more likely to experience depression. They're more likely to experience dementia. They're even more likely to fall, which is the leading cause of death for people over the age of 65. Now, the good news is that many cases of hearing loss can be corrected. Technology is advancing at an incredible speed. Hearing aids are smaller. They're more effective than ever. Dr. Shuren, do you know how many of those 48 million people with hearing losses actually use hearing aids?
It's about 20%.
About 20%. Johns Hopkins researchers think it's actually about 14%, even smaller, but somewhere in that range. The vast majority of people with hearing loss are literally suffering in silence. And there are a lot of reasons for this, but do you know, Dr. Shuren, what it costs to get a hearing aid?
About $2,000 in that ballpark.
For each aid. That's exactly right. Out-of-pocket costs, it's not covered by Medicare, and most people need 2 of them. So that's $4,000 to kind of get you in the door on this. Earlier this month, Senator Grassley and I wrote an op-ed in the Journal of the American Medical Association about this problem. And this morning, Senator Grassley and I introduced bipartisan legislation with Senators Hassan and Isaacson that would help reduce the cost by directing the FDA to create a category of over-the-counter hearing aids. Now, Dr. Shuren, last December, the FDA announced, and I'm going to quote it, a commitment to consider creating a category of over-the-counter hearing aids that could deliver new, innovative, and lower-cost products to millions of customers. Can you walk us through quickly why over-the-counter hearing aids could improve both access and affordability to hearing technology for Americans with hearing loss?
Well, if we make it over-the-counter now, patients wouldn't have to go through a healthcare practitioner. They could get it, let's say, from a pharmacy. And of course, as we reduce the cost for technology to come to market and we have greater competition, we'll see prices go down.
Well, that's good to hear. Better access, lower prices. You know, it's good that the FDA is thinking about this. I'm really glad to hear this. The legislation that Senator Grassley and Senator Isaacson and Senator Hassan and I have put together would help make sure that it actually happens, and that these devices, when they're made available directly to consumers, that it's done in a safe and effective manner. And this is my last question. Can you just say something about the kinds of concerns you'd want to be sure are addressed in order to make sure that this is done in a safe manner for people with hearing loss?
Well, we'd want to make sure that patients understand how to use the hearing aids, that we have good labeling to explain the circumstances under which they should contact their healthcare professional. And we might also look at performance characteristics, should there be any output limits.
Right. I appreciate that. We really do need to do this right. I know there are plenty of cases where over-the-counter hearing aids won't be appropriate. That's fine. But right now, there are millions of Americans whose lives could be made so much better if they had access to low-cost hearing aids. You know, this is a place where we could loosen up outdated regulation, and with a few consumer protections put in place, we could actually let the market work to help bring better products to people at lower costs. Thank you very much for the
Thank you, Senator Warren. Thank you for the legislation.